So, the first question to consider in our study of addiction is how we will define the word. Until the modern era, what we now call alcoholism and drug addiction were seen as moral failings. With the introduction of the disease concept of addiction, this stigma has largely been set aside. Addictions to behaviors, excluding chemical dependencies, are still seen by many as moral failures or lack of the will to live correctly. Take, for example, Tiger Woods being met with mockery when he claimed that sex addiction led him to cheat on his wife. While the medical industry has adopted the disease model of treating all addictions, long term recovery is still seen as the purview of support groups and programs with a spiritual basis. How is it possible that a purely medical problem requires a purely spiritual cure? The treatment and the diagnosis seem incompatible. Regardless of individual anecdotes of recovery, there remain many people who do not recover successfully with current models of disease pathology and current methods of treatment. The treatment industry thrives on repeat business. In other disease scenarios, such a rate of relapse would lead to calls for more research or better treatment options. But the unique nature of addiction is that responsibility for failure or relapse is placed squarely on the shoulders of the patient. The origins of addiction are shrouded in mystery, assumptions, and misunderstandings. According to the new science of epigenetics, it seems likely that some people do carry a genetic predisposition to addictive tendencies, but those genes will either be activated by certain situations in a child's early life or they will remain dormant. One thing that most addicts have in common is that the addictive behavior is a response to some kind of pain or trauma.